You might recall the COVID Comm system, something we talked about last winter. Well, Governor Hutchinson reinstated it in July as the summer surge began. It's become a useful tool, but now it's critical.
Our Jay Burr visited MEMS today, where the COVID Comm system is operated. And Jay, how are they handling the current situation that we're in?
Well, guys, as you said, COVID Comm is actually a part of Arkansas's trauma system, and they track who has what kind of room and what the availability is, and also where in the state those available rooms are at. And seeing the dashboard in red a majority of the time just illustrates just how dire this situation is. Much like the tower at Clinton National Airport tells airplanes which runways to go to and when, COVID Comm program manager Jeff Tabor says their dispatchers work the same way.
We're coordinating destinations for nearly 800 ground and air ambulances for trauma, 90 hospitals for trauma, and now every hospital in the state for COVID.
The mission is simple.
Our goal is to get the right patient to the right hospital, the closest, most appropriate hospital.
There are 43 hospitals in the system to handle COVID patients. Patients are assigned different levels based on a clinical assessment. They're then sent to hospitals capable of handling their needs, which recently have not always been available.
Started with some wiggle room in there and so on things, but the last week, the last few days has definitely been more difficult.
They have sent patients from one corner of the state to the other, but if certain levels of beds are not available, patients have to wait and the lines have gotten longer.
It ebbs and flows. That is the limiting factor. We put those in a holding pattern and continuously monitor the dashboard, which the hospitals keep up as live can be.
Tabor says the general public needs to do more to help keep cases from taking off.
The public assistance is so much more needed now, i.e. vaccinations, mask wearing. We're back to having a social distance, and so if the public would just be a little more involved in the healthcare system that we have now, it would help tremendously.
Now, Tabor adds that many times people will call them and they'll actually wait for hospital rooms to be open that are actually closer to them. And he does say that many hospitals will actually fill some of the rooms that they do have when they come available before they can update the dashboard. He does say they don't actually correspond or work with any hospitals that are outside of the state's borders, but other hospitals sort of in those border towns, Fort Smith, West Memphis, etc. He says they do work out some of those things on their own accord. Over now, live outside of MEMS here in Little Rock, Jay Burr, KARK 4 News.